Hello everyone, thank you for joining us here today. My name is Matt, I'm the marketing manager here at RMA of Connecticut, and I'm joined by Dr. Shaun Williams, board certified reproductive endocrinologist here, and Mark Elliott, one of our embryologists. Some would say our favorite embryologist, but depends on who you get.
Some would say that.
Some would say that.
Make me blush.
So
Others of us might have other opinions. I'm just kidding.
there's different opinions.
Yes.
So we're here to talk about Movember, men's health, and men's fertility. And just to give an overview, Movember is the leading charity that's working to change the face of men's health, as they say. So that's why you see us gentlemen here sporting various amounts of facial hair to maybe varying degrees of success. I don't know.
This panel was chosen strictly on the demandiness.
We have the
of
best looking facial hair, I would have to say.
We'll go with that.
On the group, yes.
So we've been chosen to represent RMA of Connecticut in this discussion. And really, Movember is all about a few key initiatives that would be prostate cancer, testicular cancer, and mental health and suicide prevention for men. And so that's going to be kind of what we'll start this discussion with, and then we'll jump into some more specifics as it relates to male fertility and men's health in general. So as we're going through, feel free to send along your questions. We have a feed going, and hopefully we'll get to them at the end and we can answer a bunch. So feel free to drop your questions in at any point, and we'll get to them. So gentlemen.
So yeah, I think the concept of the whole Movember organization is exciting, and I don't think I would be sporting any type of facial hair. Of course, the rules are that you should just be growing a mustache in November. It's the Mo, that's the part of the Movember, but I've tried that before, and I can't rock the mustache. It's got to be everything. I'll shave this lower part off a little bit later, but we are, I wouldn't be doing this if it wasn't for the ability to raise some awareness regarding these other aspects of men's health. Now we know that heart disease still remains the most common reason why both men and women, leading cause of death for both men and women. But there's specific men or specific diseases that focus or that are specific for men, such as prostate cancer, testicular cancer, and what most people don't think about is the mental health and suicide aspect of cause of death for many men around the world. I mean, it's estimated that every minute someone dies of suicide. A man dies from suicide from around the world. That's 60 deaths an hour. That's pretty amazing. And so the organization, and the reason why our faces are so scratchy is just to remember that and try to get information out there about what we can do to try to at least understand, sometimes identify, and sometimes help men live longer in the face of these diseases being present.
Definitely. So, I mean, with that being said, what kind of steps can we take as men to prevent some of these conditions, or to work on early detection of certain cancers, particularly testicular and prostate?
Well, first and foremost, make your appointments with your doctors. Get those appointments, get the screening. In particular, get your prostate screening and testicular screening. And if you're stubborn like me, have your wife do it. And that's the first step.
Schedule the appointments?
Yes,
is that what you're saying?
schedule the appointments, yep. It's first and foremost. It's
Good.
getting checked out.
Yes.
Yeah. I mean, prostate cancer is something that affects men as they get older. And, once you're over 50, 45 or above, if you have family history of prostate cancer, or African Americans are at a higher risk of developing prostate cancer, then undergoing surveillance and evaluation at the physician's office is the best way to detect these cancer, or at least prostate cancer, early. And hopefully earlier intervention may help allow higher survival rates. With prostate cancer, it's sometimes a slower growing cancer, and so the treatment options may vary compared to testicular cancer, which is another male-specific cancer, which can occur at any age, usually from age 14 up to age 90. Testicular cancer can occur. And testicular cancer can have some more significant problems. Now, we are identifying more people with testicular cancer these days, probably because of better surveillance and understanding what the best way is to identify testicular cancer. But with treatment, about 95% of individuals diagnosed with testicular cancer are able to survive and live a normal life. There are some consequences of some of the treatments of testicular cancer,
Right.
which we'll talk about, but early surveillance through just self-examination, understanding what your testes are, feel like through testicular self-examination, and identifying any changes, any lumps or irregularities, and having those detected is the best way to identify testicular cancer early, so that it can be treated before more significant problems occur.
Yeah.
And the mental health aspect of the Movember Foundation, we just have to keep in mind that men tend not to talk to people quite as much, keep
To bottle
things
things up.
inside. Yeah.
Yeah.
And so remembering that that's a significant issue, and that having a support group, having a support group
Right.
of other guys and being comfortable talking with each other can help with some of the many significant mental health issues that can often lead to suicide.
Yeah, I mean, it's kind of interesting. There's definitely, I've seen a growing number of men's groups in my area. I feel like it's kind of like throughout the country, really. And I totally agree. Like having a core community that you feel comfortable with, and so really goes a long way. So, what kind of groups are you guys involved with, or what do you do, for that kind of looking for that community, and what outlets do you go to?
Sure. Well, I like to go to the gym, so
Yeah.
I'll go with a group of guys that I work with, some other embryologists. We'll meet at the gym, work out.
That explains why you guys are all so muscular.
That's right.
I was wondering.
Is that y'all? Does that include me?
Yes, sure.
It is a great way to vent and discuss, issues
Yeah.
with your friends. So that's a great outlet.
Yeah, that's awesome.
Yeah, it's nice having a group of friends.
Yeah.
It's sometimes harder as you get older to find a close group, but having sharing common enjoyable things together often can bring you together. I know I have a group of friends that I've been playing soccer with for years, and every Thursday night we get together, we play soccer, and then we go to the bar afterwards and we rehydrate and refill all the calories that we burned. And it's a great time to just be together. We see the same guys. It's easy to open up, and it's easier to talk to people that you share some common bonds with. I mean, one statistic that I saw is that when you ask men, it's like 75 to 80% of men will say, yeah, they're there to listen to their friends if their friends want to talk, but only like 30 to 40% of men feel like they can talk to their friends. So we're there and we're willing to listen, but nobody's
Kinda
talking.
interesting.
So
Yeah.
Surface
we have to
level.
remember
Yeah.
is to talk to your friends and to get these things out there, because that's what communities of support are there for, is to help individuals make it through often some difficult times.
Yeah.
So don't be afraid to open up, guys.
That's definitely true. So, indoor soccer, outdoor soccer,
Both. Indoor during the winter,
Okay.
outdoor during the season, in the spring and the fall.
Yeah, cool. So for those of you who might have just joined us recently, I'm sitting here with Dr. Williams and Mark Elliott, one of our embryologists, and we're talking about Movember and men's health. So feel free to send your questions along as we kind of go from here. We just talked a little bit about Movember and some of their key initiatives, and now I'd like to segue a bit into talking about some male factor infertility specifically, and what kind of the diagnosis for that looks like, and what maybe some treatment options are too. So yeah, if you guys could kind of provide a little bit of background about what male factor infertility even means, because I feel like I know for myself at least it's not very clear what that is, or how it's maybe different than other types of infertility, and also like the prevalence of male factor versus other types of infertility too. So Yeah, if you guys can
Yeah, I mean, so
give me some context.
transition from like the Movember movement, some of these issues like prostate cancer and testicular cancer definitely can have some pretty profound effects on fertility. The treatments for both of those can sometimes leave men, unable to have children in the future. Now, prostate cancer usually affects older individuals, but we do see, men in their 50s, even in their 60s these days, who are still, in the process of building their families. But especially for testicular cancer, which can affect teenagers and young men, the treatments, such as surgery to remove the tumor, as well as radiation therapy and chemotherapy, both can leave men completely sterile, unfortunately. And we do have some treatment options that can help address some of the fertility aspects associated with these diseases. Fertility preservation through simple sperm cryopreservation in our laboratory before surgery, before chemotherapy, before prostatic surgery can allow samples to be available that we can use very effectively, many years in the future. We've been cryopreserving sperm samples for years with very good results. I've had men who have had samples frozen for over 30 years who have thawed those samples, and pregnancies occur, very healthy, normal pregnancies. And so part of the awareness of testicular cancer and prostate cancer from our point of view is also to help raise the awareness of those who have these disorders, the doctors who treat these disorders, that some of the profound effects that can have a significant effect on someone's overall life and quality of life, such as childbearing, need to be addressed and need to be thought about as well when you think about some of these diseases, not just surviving these diseases, but what life is like after you survive these diseases. We hope that more men survive these diseases, but we're also more concerned on making sure that men are able to accomplish all of their goals as well. And so specifically, those are certain situations associated with these diseases. Sometimes we see following these surgeries that there's just these therapies, there's absolutely no sperm available. And so when we talk about male factor infertility, we're talking about anything that can keep sperm from getting towards the egg. Mm-hmm. And many times we're able to identify what some of those problems are.
Right.
Part of male factor infertility is not just with sperm production or how the testes are functioning, but also just in sperm delivery. From problems with intercourse, problems with erectile dysfunction, ejaculatory dysfunction. All of these things can prevent sperm from getting where they need to be. But we also see male factor infertility or problems with sperm function in men who have just very normal anatomy and completely normal sexual function. And these abnormalities we identify through a semen analysis.
Yeah.
And Mark works with sperm on a daily basis,
every day.
and he's looking at the samples of the semen analysis. Talk a little bit about what you do when you look at that sample and what we look for.
So right off the bat is we're looking for motility. We want to see that the sperm is moving, and not only is it moving, is there forward progression? Because sometimes sperm will just be moving in circles, and that's not
sometimes it's lazy sperm. Yep. Exactly.
It's lazy sperm.
Doesn't
Yep.
And a reflection on the gentleman himself.
Exactly. And
common.
we don't care too much about volume because a little goes a long way, but we're also looking for the morphology. Is it normal looking? Does it have a head? Does it have a tail?
The shape of the sperm.
The shape of the sperm.
I mean, what do you mean by that? There's like, it's not all the sperm look the same.
Yes. So sometimes you'll have all sorts of different variations in how the sperm looks. You can have sperm with big heads, sperm with little heads, sperm with 2 tails, 3 tails.
Wow.
So it can vary quite a bit in morphology, the way it looks, and that all those different variations can affect the way that the sperm moves and if it's able to reach an egg. So we see quite a bit on a day-to-day basis here, and all these things are, for the most part, we're able to overcome some of those abnormalities.
Right, and when we look at many different things in that semen sample,
Yes.
and we've been able to associate difficulties conceiving with different abnormalities that we see. And so someone could be completely healthy with no prior risk or history, or risk factor or history of any reason why sperm production may be abnormal, but sometimes we see that it's just not swimming very well, or that the number of sperm is lower, the volume is lower than it needs to be. And so The most important test to understand sperm function and production is the semen analysis. And we would encourage anybody who has a concern about, how their reproductive system is functioning at a first test is to do a semen analysis. I mean, we want every couple who's already experiencing infertility, we need to see what that sperm count shows. Sometimes we have a hard time getting, men in to do that test. Sometimes couples want to wait until all the tests for the woman are completed before doing that semen analysis, but we really need to see that. I really applaud those couples who the first test they do is a semen analysis. We have the guys that are, I'm going to go get tested. And so we encourage that because it's such an important factor. So half of all the identifiable problems are male factor problems, and so it's a pretty significant number of patients that we see.
Wow. Yeah, so what is a semen analysis? So let's I know we're kind of it's a little taboo to talk about, but what really goes on? What's involved in a semen analysis? And obviously there's a lot of apprehension. And what should someone expect if that's something that they're going to need to do?
Yeah.
Sure. It's definitely something a guy's not used to. It's a private thing, and they have to come and produce. And they can do it at home, but more often than not, they'll come to the office, and we have it set up for them. And they'll produce a sample, and it will pass through our andrology lab onto our embryology lab. And then we'll take a look at it. We'll do a morphology on it. We'll do a sperm count. And then from there, we'll usually clean it up a bit, and then we'll use it to inseminate the eggs.
Right.
So it's involved, but it might be the easiest test a guy has to take.
Yeah, I mean,
it's worth it. It's worth it.
It is sometimes just setting up a time to come to our office and produce a sample here. We've got some collection rooms that are private. Most individuals are able to do that, and then the test is done.
Right.
We drop the sample off, we analyze it, and that's it. We do have ways to collect at home. We can bring a sample in, or men can bring a sample in from home. We have different ways of collecting those samples, or collection condoms that can be used, so you can collect a sample just during regular intercourse. We like to get fresh samples to analyze right away, so there's no changes that happen just with temperature changes or with
Time sensitive.
traveling into the office. But we have many different ways to assess that sample, and we hope that it's easy for men to find a way that makes it comfortable for them, because it is very important information to have.
That's great. So I think with all that being said, I'd like to talk a little bit about what maybe men can do now, or they can do earlier, or start whenever, to kind of protect their future fertility, or things that they should be aware of that might have an impact on their fertility. And then eventually I would love to turn it over to see what kind of questions that you guys have out there. So make sure that you're submitting them, and hopefully we'll take a look at them here shortly. So if we can just chat a little bit about what kind of factors men should be on the lookout for, or should be aware of, at least as they relate to their fertility.
Yeah, I mean, it's anything that can affect your overall health, any type of lifestyle changes or habits that can affect your overall health definitely can have an effect on sperm quality as well. Smoking, obesity, alcohol to excess, marijuana historically, but verdict's still out on some newer studies regarding marijuana usage. But any health issues that can affect your overall general health can affect the quality of the sperm. Then there are some specific things that also can affect sperm, and we've talked about the use of anabolic steroids and testosterone supplements that can completely shut down sperm production and act as a male contraceptive. And so, basically being as healthy lifestyle, healthy diet, healthy body weight, physically active, all of these things can help prevent, future heart disease, which again is the number one cause of death for men, but it can also allow just more normal reproductive function. Now again, some men can be completely healthy, have the most healthy lifestyle with no bad habits, and still have problems with sperm production. And that's frustrating. And so again, understanding your potential often involves checking a semen analysis. And if there's an issue, then you address that issue right away. If sperm counts are fine, if it looks like things are functioning normally, that's great. Hopefully there's no significant issue associated with at least sperm production. Doesn't mean the sperm still function normally. There's one aspect of male infertility that involves how the sperm and the eggs interact once the sperm are actually able to swim up near the eggs. So we never know how easy it's going to be for some couples to get pregnant unless they try. But avoiding unhealthy habits and being as healthy as possible is what anybody can do to prepare for at least a healthy life.
That makes sense.
Men want to be kids. We want to have kids, and we want to be around for our kids for a long period of time. And so focusing on healthy habits now allows us to accomplish those goals in the future.
Yeah.
And that's the frustrating thing about male factor infertility is that sometimes we can see some pretty severe changes with the sperm count without any identifiable cause. There are some things that we can find. If somebody has no sperm in a sample, then we can sometimes find some causes for that. Sometimes there's an obstruction or a hormonal issue. But if somebody just has a count that's in a lower range, hard for us to address that. We can't find most of the time, we can't figure out why that is. There are some situations where we can, but most of the time with just a low sperm count that puts couples at a risk for experiencing infertility, we're unable to figure out why that is. And we're unable to treat that either. But we do have excellent treatments for male factor infertility. We have treatments that can completely overcome the problem with sperm function and sperm delivery that can overcome any problem as long as sperm are there.
Right.
There
So
are,
what are some of those treatment options then?
Well, whenever we're dealing with sperm, at least the inefficiency of sperm interacting with the egg, we've got two options really to effectively treat those changes. We can concentrate the sperm and perform an intrauterine insemination, where we just pass as many sperm as we can up higher into the system so that we're getting more sperm closer to where the eggs are, usually at a time when we have a few more eggs out there, to increase the likelihood that sperm and eggs can interact normally. If that's not effective, then we can get sperm and eggs together inside the laboratory. We can take eggs from the ovaries, we can take a sperm sample, and as long as we have, 10 to 20 sperm, we're able to fertilize 10 to 20 eggs very effectively. We could take a small little microscopic needle, which you do every day, take a most normal appearing sperm and stick it directly into an egg through a process called intracytoplasmic sperm injection.
That's pretty
It's a bread and butter.
amazing.
It's a slam dunk approach.
And we're doing that daily in the
On a
laboratory.
day-to-day basis. Yeah.
It's pretty
Wow.
amazing. And so
Yeah,
there are some
pretty
men who would
amazing.
never be able to get pregnant based on the concentrations. And there's nothing that we can do about it. Or there's some men who have obstructions who are never able to get pregnant because we just can't get enough sperm from behind those obstructions. Because if somebody has some obstruction or if they've had a prior vasectomy, then the sperm is still being made within the testes and we can extract that sperm, but we just never get enough to be able to place up into the uterus to allow pregnancy to happen. But we definitely have the means to ensure that eggs get fertilized. So we can overcome any male factor with the treatments that are available. It's probably why there's not a lot of research going on to try to help understand what could be a cause of, I mean, there is, but it's, our focus has been on using the sperm that's there, and we can use it very effectively. And we don't have to, at times understand exactly why sperm counts are low, and it's very difficult to find out how we can change that. But we can use the sperm that's there very effectively.
Absolutely.
That's pretty amazing stuff. All right, so I think at this point we'd like to go through some of your questions out there. We have a couple. Yes?
Got a couple.
Okay, cool.
Okay,
What do you
one
got?
is what percentage of infertility is male factor?
So-
So you can repeat the question
Okay.
so everybody hears.
So the question is, what percentage of infertility is male factor?
I mean, generally, when we go through the evaluation, we'll see that 30% of causes of infertility are purely due to a male factor. 30% are purely due to a female factor. There's about 10 to 15% that overlap, and then there's about 30% that's unexplained. So about half of the identifiable causes I mentioned before are male factor issues, which makes sense. Half of the equation is the
Pretty
sperm.
even.
Yeah.
Even playing field.
Sorry, guys. It's not-
I mean, more
it's not
processes
overflow.
happen within the
Right.
woman's body, and so we do see more problems. There's problems with ovulation, there's problems with the tubes, there's problems with the uterus, there's problems with the female hormones.
Right.
But we see semen analysis abnormalities about half of those identifiable times, whether it's poorly swimming sperm or concentration issues or problems with sperm delivery, whether it's with intercourse or erectile dysfunction. All of those contribute to half the identifiable causes.
Not that it's a blame game, but just
No, it's not. It's
Not at all.
a sometimes it's an inefficient process.
all right. Other questions?
Okay, another one is how long does it take to receive my semen analysis results?
Okay, so how long does it take to receive a semen analysis result?
That's a good question. I know for the day of retrieval, we analyze the sperm within an hour of us getting it. So we'll have your results. We'll have it done within an hour, and then it goes back to the doctor, and then the doctor, he or she, will let you know.
Yeah, generally with a regular semen analysis, we're
It takes a
also
little
doing
longer.
that morphology
Yeah, it takes
stain
a
where
little
we're looking at the shape. It takes a little bit longer, but generally we have the results by the next day.
Yeah, pretty
Wow.
quick. Pretty quick turnaround.
That's awesome.
Yeah.
Okay, we got another one.
Other questions?
Yes. Do abnormal semen analyses or sperm lead to children with birth defects?
Okay, so do abnormal semen
Sperm.
analyses or sperm lead to children with birth defects?
Well, it depends on what we consider abnormal sperm, but in general, when we see a problem with sperm production,
Right.
there's fewer sperm that are swimming, or the shape of the sperm is abnormal. We haven't seen any significant problems with children born following any of our treatments like intrauterine insemination or intracytoplasmic sperm injection. Now, there are some situations where there's more severe male problems, and some more severe male problems may be related to chromosomal issues such as Klinefelter syndrome or other abnormalities that can affect the Y chromosome. And some of these men may have sperm, and we do see that there are more abnormal, the DNA within that sperm may be more abnormal. And when we do some procedures like in vitro fertilization, we do see a higher risk of having embryos or developing embryos that have an abnormal chromosome number. And some of these changes can lead to miscarriage. Down syndrome is a problem with the chromosomal issues. Now we don't see an increased risk specifically of Down syndrome, but in general, these chromosomal abnormalities may be more common in men who have severe sperm production abnormalities related to underlying chromosomal problems. But in general, if our thought is that the reason a couple's not getting pregnant is because sperm production is lower than where it needs to be, or the shape of the sperm is less than what it needs to be to fertilize the eggs, the DNA within the sperm generally is still good, and we see good embryos that develop once we overcome some of the mechanical aspects, how the sperm swims and how the sperm interacts with the egg.
And there is still some testing, right, that could be done maybe as embryos are developing to eliminate some of those factors or look into that a little bit more, right?
Right.
Yes.
That's
so
available.
We have available genetic testing, and we biopsy a small portion of the embryo, a few cells, and we can ship those cells out and have them tested for any abnormalities.
Mm-hmm. And any individuals who are going through IVF because of some of these issues that can increase the risk of chromosomal problems, we're often recommending that they consider doing that extra testing just to ensure that the embryos that we're replacing back into the uterus are normal and not affected by any increased likelihood of chromosomal problems.
Sounds good. I think we have one final question here.
Yes, and you kind of touched on it a little bit, but maybe you can corral all the answers together. It's what common factors hurt male infertility or male fertility?
So what common factors hurt male fertility?
I mean, most common is probably smoking. That's a common factor. Who knows about vaping?
Right.
Again, historically, we thought marijuana usage was becoming more common now that it's being legalized in more states. There have definitely been studies that have shown decreased sperm production, but there have been some more recent studies that haven't shown quite as significant impact on sperm production.
You mentioned steroids as well.
Right.
Oh yeah, and steroids is something that's also more common that definitely can affect sperm production.
Right.
What about things like, I know you kind of hear it, but like soy and like those phytoestrogens and stuff like that.
So you really have to have a lot of soy to get some of those estrogenic changes happening within your system. Just simple increased amount of soy in your diet, soy milk in your coffee, tofu, none of that is going to significantly affect male factor infertility.
Okay.
Or at least sperm production.
All right. Sounds good. That one went over my head, but I think you guys covered it well. So I think that's a wrap for all of us here at RMA of Connecticut. Big thanks to Dr. Williams and Mark Elliott for joining us here today, and thank you guys for tuning in.
Thank you.
Thank you.